Good morning and welcome to Community Issues this morning. If you have any questions or comments regarding this show, you can call me during regular business hours at 793-7733 or email me communityissues@AdirondackBroadcasting.com. And with me this morning, I have Corrine Helper with me this morning. And Corrine, tell our listeners where you're from.
Hi, nice to be here. I am a doctor of audiology, and I practice in New York City.
And you're from the High Health Institute?
That's correct. HealthInnovations.
High Health Innovation. We're going to be talking about hearing this morning. So let's go way back to before we were born. Okay, we are just about being developed. We're maybe 6-7 months old, and I've heard of stories of parents talking to the child. When does our hearing actually begin? That early, or do we have to actually be a couple months old actually for our hearing to actually develop?
Well, that's a great question. A lot of research has shown that actually in the womb, the fetus can actually hear the mother's voice and just be aware that that is their mother, and that's the mother's voice, and that she's trying to communicate with them. So it's very interesting. It's a pretty complex sense that we have, and it's wonderful.
And when you say that the child can hear the mother's voice, is it like an octave pitch? Is it actual words, or is it an actual bonding experience that they're feeling?
It's definitely proven to be a bonding experience. Some research has shown, as far as octaves and frequencies. That statistic I don't have access to right now. I can get back to you with that information. But it absolutely is true that in the womb, the fetus is aware of the mother's voice and responds to it.
Now, as we grow up and our hearing develops, from an infant to a young child to a teenager to a young adult to an adult, are there stages that our hearing goes through from, let's say, point A to the present?
Well, many newborns in New York are screened before they actually leave the hospital within 3 days of birth. So, since you're born, you do have a lot of the anatomy and are able to hear and detect different sounds at different frequencies and octaves. And as you get older, of course, your anatomy changes and you're exposed to different noises and sounds, which, affect your hearing. And depending on the intensity and the duration of those sounds can actually harm your hearing. That's why it is so important to get your hearing tested at any age. You get a baseline test, so you're able to be aware of what status your hearing is at. You
brought up a good point of getting sick and things of that nature, and I'm gonna throw some things out there that may be around today, that may not be around today. I know, the common cold. Everybody gets one. I try not to get a cold in the winter season. Does a cold affect our hearing? And could it damage our hearing?
Sure, that's a great question. Absolutely. You could get a cold that impairs your hearing. Usually it's temporary. And when, you feel better, either with some treatment, the cold, goes away and your hearing can improve. It used to be years ago, there wasn't access to a lot of doctors and treatments, and so if you did get a cold chronically, that could have affected your ear anatomy permanently and possibly have caused some hearing loss and damage. It's pretty rare in the United States. Usually people are able at this point to go and get treatment, and that resolves with the common cold.
And I I'm gonna, like, I know when people, when they have the mumps or the measles or they have some kind of fever that my mother had a fever when she was a child, and I it's not around today, but can something, and I'll just throw this out there, and I'm not sure if it could. Well, we'll use it as an example. Something like if you had the mumps, in this day and age, could that affect your hearing in any way?
There are certain viruses that people can contract, and that will affect the hearing, the ear. It's very important to, get help right away, keep yourself, healthy and safe. But absolutely, especially years ago, with, again, lack of access to medical health professionals and treatment, mumps and other, measles did cause a permanent hearing loss.
And
sure.
I remember, and I've been out of school for so long, and I'm not sure if they even do this anymore. The high pitched little tone test they used to do. Put some headphones on you and raise your hand when you hear the tone. Do they still do that in schools in this day and age, or is that more the parent sends them to your healthcare physician and they do it there?
That's a great comment. It is common, unfortunately. Not every school or preschool does have that. It is critical in those developmental years, children learning speech and language, and they're growing. It's such a critical time for them to be tested. A lot of places offer complimentary tests. Again, they are done at some certain schools, and not every school, so the parent does need to find out. And if it's not done at the school, then definitely the family doctor or pediatrician should be able to do the test or recommend a facility that does conduct the hearing test.
You brought up a great point of people hearing certain things and developing something. I have relatives that they were born here in New York State, and as children they moved to Boston. And the big joke was when they came home for their first holiday, they had that Boston accent, even though they, lived in New York State for the first, few years of their life. When a person moves, whether it's a child, a teen, and especially an adult, if they move to, somewhere in New York City or maybe Boston or some southern state where there's an accent, do we pick up that accent because we hear it? Because it's the norm, or do we pick it up just out of what are the reasons behind that?
That's a great question, and just the way that people develop language is with, listening, hearing. Usually, it's within a certain amount of, developmental time. Like I think after the age of 11, it's very difficult to kind of lose an accent. Or really get trained to reduce an accent due to that critical time in your life where you're developing different language and speech skills.
What is the best time for a child to start developing? When is the peak time they develop their hearing?
It used to be said that critical, learning language was around 5-year age mark. But now we want to get the children tested 0 to 3 months, make sure their ears are healthy, and 0 to 6 months is extremely critical in the child's, in an infant, a newborn development.
And
but again, we don't stop at that 6-month mark. Of course, you develop speech and language all the way to your school-age years.
And it's very interesting because if a person has some kind of hearing disability, it makes speech a little more difficult for them to comprehend, correct, or to talk with a person because they can't hear how they're saying a word, and they don't know if they're saying it correctly. Am I correct?
You are correct, Tim. That's great. It's very true. That's why a lot of That's why it's critical. And in New York, we really want to test the newborns within the first 3 days of life and catch those newborns who maybe did not pass the initial hearing screening, and then refer them for more in-depth testing. And then if that does show an impairment, treat them sooner. So this way they're fully equipped to really learn speech and language and develop normal.
Well, can we talk about the do's and the don'ts of hearing? Now I know you and I we've had our younger days. I'm sure you're still 21 and holding, as I like to say. We've gone to our
right back at you.
We've gone to our rock concerts, and we've wanted to sit up front and really feel the vibrations from the speaker. And the last concert I went to was Kid Rock last year, and I was actually in the last row of the amphitheater before the lawn seats. And I kid you not, when he came out and he performed, my genes were vibrating because of the sound system. What kind of damage does loud music? People, look at loud or whatever. If you're up that close and you're near the speakers, what kind of damage does that do to your hearing?
Sure, that's a great question. And usually you can tell if you have damaged your hearing because you will get a ringing or buzzing sound, or tinnitus or tinnitus, as some people say. Really, when we talk about a noise-induced hearing loss, either to music or to tools, a lawnmower, or even, being in the military or vets, being exposed a certain amount, we talk about two things, the duration and the intensity. Okay, the duration of how long you're being exposed to the sound, and the intensity, the volume of the sound. And obviously, the longer you're exposed to it, the more damage can be done, and the higher the intensity the damage is done. And usually the first sign is is tinnitus.
And that's fascinating. Let me ask you if this is an optical illusion, or if it's just the way technology is today. We have our flat screen TVs with surround sound and fixed and audio and fixtures and stuff like that. And the other day I was just messing around with the TV audio just to see what it was, and there was different volume settings. And when I would check one volume setting over the other, I'd have to turn the TV up to actually hear the TV better. Is technology gotten too far to where they're making audio a little more difficult for us to hear, to where we have to turn it up a little louder, which could damage our hearing?
That's an interesting point. Technology has definitely improved. It still has to do with the amount of intensity that the volume is at and the duration. So now, back in the day, if you listen to a Walkman, I think the Walkman held about 10 songs. Now, if you have an iPod, they hold hundreds and thousands of songs. So you see the amount of time people are listening to music and watching the TVs and these different types of screens is a lot longer, But it also has to do with the amount of intensity. So it's really hard to say. It depends on what level it's actually at.
Are there ways we can, especially as we get older, are there ways we can strengthen our hearing?
Strengthening your hearing, there's no vitamin at this point or any type of medication for, noise-induced hearing loss, a permanent hearing loss that we would recommend. But there are ways to protect your ears. A couple of rules. I would, first and foremost, try to limit your exposure to loud sounds like music, lawnmowers, motorcycles, to no more than 20 minutes at a time. For someone like you attending a lot of concerts or sporting events, consider wearing hearing protection. A lot of research has shown being exposed consistently to loud sounds above 100 decibels, let's say, can permanently affect your hearing. Normal conversations about 60 decibels. That's one thing to consider.
And we thank you this morning, and I just have a few more questions, a few that may stump you, and that's what I'm here for.
Okay.
Something happened to me a week ago, and it's kind of driving me not insane, but just curious. As I was washing my hair, I got a little water in my ear, and I kid you not, I turn my head and I hear squishing in my ear. Is that water in my ear? And how do you get rid of water in your ear if you get water in your ear?
That's a great question. Yes, absolutely. When swimming, now it's summertime at a pool or a beach or showering, bathing, you can get water in your ears. Your ear canals are curved, so sometimes the water can actually sit there. I always recommend taking the edge of a towel and kind of, just trying to get it into the outer part of the ear canal to dry it out. Or if you have a hair dryer, set it on a cool setting and keep it about 6 inches away from you, 6 to 10 inches away from you, and kind of, blow at your ear until it kind of dries out.
Or I could find...
If it's a chronic problem, you could actually also get earplugs.
Oh, okay. Or I could find the woman of my dreams and she could blow in my ear and see what happens. But I'm just that's another.
That's what I would recommend. That was my next recommendation.
That's another story for another time. But if a person gets water in their ear, I mean, will it eventually evaporate or will it eventually come out?
Yes.
Okay.
It could either evaporate naturally. You can actually come out of the ear naturally. Sure. Sometimes if your ear canal is too curved and it sits there, could cause a little bit of an issue.
It's not
an itching.
Yeah, it's just like I turn my head and I hear squishing. I'm like, well, at least I know I'm still here. And I'm going to say a bad word, so I want you to just relax. Q-tips.
I'm going to pretend I didn't hear that.
Okay.
That is a common question.
I see them in the store all the time, and of course I buy them. I don't go crazy with them, but what are some of the do's and more don'ts with Q-tips than anything else?
I actually tell all my patients not to use Q-tips. You cannot see into your ear canal, so you don't really know how far you're going. If you're pushing some wax further deeper into your ear, it can cause some discomfort, pain, like a laceration, an infection. It can cause some, serious damage where you would need treatment for. So I do not recommend Q-tips. I know some people really like to clean their ears, maybe just on the outer part of the pinna of the outer ear, and just carefully not to go all the way in at all into the aperture of the ear.
And how do we clean our inner ear? Does it do it automatically?
Yeah, the ear naturally has that, can clean itself out. I do recommend every time, after a person showers, using like a towel to kind of, clean their ear. And also whenever you go to the doctor, have them look in your ears to see if you have a buildup of wax. Having wax in your ear is normal. Everyone should have a little bit of wax. When it gets excessive or if occluding the ear canal, that can cause an issue and possibly even a hearing impairment. So when you're at the doctor's office, have them look in your ear and then they can remove it for you. That's the safest way.
Well, it's interesting, and you're a professional, and it's just it's you, me, and all the Tri-County area listening this morning. So I'll just say this morning, and say back in my younger days when I had longer hair, the hair. I was sleeping, and of course the hair got in my ear, and when I woke up the morning and I just brushed my hair aside, it kind of popped out of my ear. And what had happened was it must have the earwax that was in there must have got around the hair and it made a human Q-tip, so to speak. Well, I kind of freaked out a little bit, didn't know what was going on, and I actually was going to the doctor's the next couple of days, and I told him about it. And he went in and it was the strangest thing in the world. he had like some kind of instrument that he used, because he like you didn't like to use Q-tips, and quote unquote cleaned my ears out, and it was the most fascinating thing in the world, because I'm not going to say I heard any better, but voices were a little louder. Is that true when you get a cleaning like that? Sure,
absolutely. The sensation and the perception of you hearing, and possibly even depending on how much wax you had, can cause you to have improvement in hearing.
And how much? And we produce wax every day, every week, every hour, every month.
Mm-hmm. Yeah, absolutely. So, it depends. Usually, some people produce more wax than others if they're on certain medications or at certain ages or certain times of the year. For my patients who wear hearing aids, I recommend them getting their ears cleaned out, every 3 to 6 months. For some other patients, it might be every year. Depending on how much wax
and
they can build up.
If it's an older person, and I think this happened with a family member, could it actually harden in your ear canal where it would take a little more of a procedure to get it out of your ear?
Yes.
Yeah.
Mm-hmm.
So
that's very true.
So it could harden like cement, so to speak. Not cement per se, but if you're thinking of it like that, that's what happens, and that's just totally fascinating. As we wrap up this morning, give us some do's and don'ts of ear care.
Okay, very good. So I would say let's follow the 60-60 rule, which means limiting the use of earbud headphones to no more than 60 minutes at a time, and at no more than 60% of the player's maximum volume. And also, I do want to stress how important it is to actually go in for a hearing test. You can contact your local family doctor, or you can go to the website at HealthInnovations.com, and we can help you find a hearing healthcare professional to test your hearing. And the tests are complimentary.
If I may, I have one more question, if I may. This was my stumper question. I, for the longest time, have slept with the fan on. Not blowing on me, just having the fan on as white noise, I guess they call it. Do we, as human beings, if we get into that state of having that fan on, and if we don't have it on, we either can't get to sleep because we're not hearing what we usually hear? Is that a psychological thing for hearing, or... Have you ever heard of...
That's a great question. Absolutely. It really would depend on first having the professional look in your ear, test your hearing, take a full case history, and then kind of go into depth about what level you're at, and if that in some way is kind of, helping you cope with any tinnitus due to a hearing loss or for some other reason.
And why do we? This doesn't happen a lot in any area to speak of. But when your power goes out, okay, I know people can sleep right through it. But when my power goes out, before you even hear the of the electricity going out of whatever it is, I'm up. How does that happen for hearing? How in tune is your hearing to actually hear a power outage and wake up?
Yeah, that's a great sign that you have, pretty healthy ears.
Wow.
You really, absolutely. That's great.
Yeah, before my fan even stops spinning, I'm up and saying, power's out. Great.
That's wonderful.
Great. But I'd like to thank you this morning for joining us. And if there's any websites our listeners could go to, you can feel free to throw a website or two out there this morning.
That would be great. I appreciate that. It was nice speaking with you.
And
the website is HealthInnovations. That's HI, HealthInnovations.com.
And we'd like to thank you for joining us this morning, Karen.
Thank you.
Have a great day.
You too.